Hello, my name is Carla Ober. I am a nurse at Valley View Hospital in Performance Improvement. I have developed a strategic plan to get Valley View Leapfrog certified by the end of the year. For those of you who are unaware, Leapfrog is a nonprofit watchdog organization that works with hospitals to provide transparency for healthcare consumers. They also work to improve the quality of the U.S. healthcare system at large by using all the data that they collect. Basically how it works is Valley View will provide Leapfrog information regarding quality and safety of care by submitting safety data as well as filling out a survey. Leapfrog will then give us a grade A through F, just like in school. This gets publicly reported so that consumers can make educated choices, and the information Leapfrog collects is used to actually lobby change in the entire U.S. healthcare system. It is completely free to apply for Leapfrog certification. The only cost to the organization is the cost associated with implementing safety and quality measures we may not have in place already. With more and more people browsing the internet and shopping for everything, including healthcare, a Leapfrog grade of B or higher could really help locals choose our facility, as we would be the only rural hospital in Western Colorado to have a Leapfrog grade. We all know that Valley View strives to be the hospital of choice for healthcare within our region and has spent the last 2 years implementing a culture of safety within the organization. Leapfrog grades are a great way to show the community that the organization provides the safest care in the region and should be the destination of choice. Working toward a high Leapfrog grade aligns with the mission, vision, and culture of the organization, and I really believe should be adopted as part of our performance improvement strategic plan. Let me explain how my strategic plan will help Valley View achieve at least a B grade by the end of the year and an A grade by the end of next year. Tackling this project will require resources and collaboration. However, we are already meeting a lot of the criteria needed to get an A from Leapfrog. You should know that performance improvement, our team, is happy to oversee this whole project and help with all the work that needs to be done to get this certification. A multidisciplinary team will be created with members from both inpatient and outpatient areas in all kinds of different services, and we plan to delegate tasks out to a lot of people so that nobody will have to do very much work. We'll have a comprehensive checklist on our shared drive so that everybody can access it and see exactly where we stand at all times with meeting our certification. We will provide due dates and prioritize the work that needs to be done by assigning each task to an individual or team, and each part of the checklist will have one performance improvement person responsible to make sure that it gets done. Weekly, our team will meet and we will provide updated metrics and reports on our successes as well as our opportunities with each measure to the appropriate people. Weekly, we will also look at the progress on each item on the checklist and review, redirect, appraise, and evaluate everything and how it's going. It will be really important for the entire organization to understand Leapfrog and its importance and to get on board. So we plan to have the CEO, Gary, announce the Leapfrog project at the next hospital-wide meeting and to the board at the end of the month. Then each quarterly meeting he can provide an update on the progress of the project, including any successes or opportunities. The Chief Nursing Officer will also be involved. She will speak to the Leapfrog project at the yearly all nursing meeting at the end of the month as well. She can explain the scope and highlight the successes of the project to keep staff inspired and engaged. Department leaders can present Leapfrog at their staff meetings as pertinent and provide necessary details. And one of the most important parts will be marketing. They can keep the internal website updated with the work that's being done, as well as external. They can advertise our grade that we have, put it on Twitter, put it on Facebook, put it on Instagram, and help attract customers shopping for healthcare services. We will have to evaluate our project and we have a variety of ways that we plan to do that. We'll have monthly dashboards detailing all the specific measures like medication safety and surgical site infections, things like that, and distribute that information to the appropriate people. Along with the Leapfrog data, we also report to a lot of other organizations, as you're probably aware, like the Joint Commission and Centers for Medicare and Medicaid Services. We plan to look at all that data that we're submitting and seeing if our Leapfrog grade and the work we're doing for Leapfrog is helping with those measures as well. We will also be looking at monthly census data and seeing if all-cause admissions increase after we have a Leapfrog certification, or if elective procedures increase, things like that. One of the most exciting tools that I found is called the CPOE evaluation tool. That stands for Computer Provider Order Entry Tool. This is really cool. It's basically like a simulation for order entry for providers, mostly with medications. So what this does is they get a test patient and they do test orders on this patient, and then it gets graded for ease of use, accuracy, and the time it takes them to do it. If we keep using this tool on a continuous basis, then we will have a way to constantly monitor and strengthen our electronic medical record. This is a big part of Leapfrog, and also a big point of frustration for a lot of providers. So this is something I'm really excited about. So that's about all I have for you today. I thank you for listening to me talk about this strategic plan, and I hope that you'll consider putting in the effort and time for a Leapfrog grade. I truly believe it will help us become the regional leader in healthcare. Thank you.